esteemed members of the Executive Board, over the last 4 years, significant achievements were made in Ghana, among which we register a decline in institutional maternal mortality ratio from 147 to 119 per 100,000 live births. The implementation of a gender-responsive accountability framework, which contributed to 37,000 vulnerable girls accessing integrated, rights-based information and services and mentoring. The proposed interventions will support the strengthening of national capacities to implement policies and enacted laws. They are anchored on human rights-based and gender-transformative approaches. UNFPA's 8-country program proposes innovative interventions to mitigate the socioeconomic vulnerabilities of adolescents and youth, particularly of adolescent girls. Ladies and gentlemen, distinguished delegates, to sustain these interventions and leave no one behind, UNFPA will continue to make efforts to improve the quality of data and its utilization through the creation of a common consolidated platform for online data management and continue to draw from best practices and innovative thinking in the region and around the world. I'd like to thank the governments of the Republic of Ghana and of the Republic of Niger for the positive and healthy partnership that UNFPA teams on the ground have enjoyed since our presence in those countries, and I thank you.
I thank Ms. Argentina Matala for her introduction. I now open the floor for comments and questions. I invite Permanent Representative of Ghana to take the floor.
Madam President, members of the Executive Board, distinguished delegates, I'd like to express our appreciation to be here today to participate in this meeting that is aimed at approving the 8th UNFPA Country Program of Cooperation for Ghana for the period 2023 to 2027. I'd also like to thank the Deputy Executive Director for her comments earlier and the Regional Director for West and Central Africa, Ms. Argentina Matavel-Pising, for her presentation of the CPD. On behalf of the Government of Ghana, I convey sincere appreciation to the UNFPA for its exemplary work in Ghana over the years, particularly in reproductive health and rights, as well as in the areas of demographic dividend and youth and gender equality. The government appreciates the partnership it enjoys with the UNFPA, especially as it relates to the ICPD agenda and the SDGs. With a predominantly youthful population of almost 73.4% of the total population, according to the 2021 National Census Report, addressing reproductive health exclusion and inequity, including socioeconomic and geographic deprivations, are key government priorities. Although Ghana is a lower middle income country, multi-dimensional poverty is still a significant concern. We welcome the fact that the 8th country program, which targets adolescents and youth, especially in the rural areas and those with low educational attainment, builds on the successes of the 7th country program and highlights the unmet need for family planning among adolescents, high rates of adolescent pregnancies, and their contribution to maternal mortality. Mindful of the fact that gender inequalities and gender-based violence increase the risk of teenage pregnancy and maternal mortality. The Government of Ghana is pleased that the 7th cycle of the UNFPA program achieved significant results that put Ghana on track to reducing gender inequality and to eliminating gender-based violence. Ghana has mainstreamed the ICPD commitments in national policy frameworks and adopted specific policies, including the 2017 Young People's Reproductive Health Policy and the National Gender Policy. The family planning uptake, although still low, is on an upward trend, and maternal mortality has been declining since 2007. With the strong partnership of the UNFPA, the government of Ghana believes maternal mortality will continue to decline. We note the 8th program adopted a participatory approach and benefited from the inputs of key government institutions, non-governmental organizations, civil society, and the UN system in Ghana. The country program aligns with Ghana's national priorities of creating a wealthy, inclusive, sustainable, equitable, resilient, and healthy society. It will contribute to achieving universal access to sexual and reproductive health, realizing reproductive rights, and reducing maternal mortality. Madam President, in concluding, we wish to reiterate our support for the 8th country program. We call for its approval and to indicate that the Ministry of Finance of Ghana, which has been designated as the coordinating ministry for the implementation of such programs, will, in partnership with the UNFPA country office, work to ensure the efficient use of the resources available for the CPD-8. We look forward to working constructively with the UNFPA and all other development partners, including the private sector, as we implement this 8th country program. I thank you.
Thank you, Madam Chair. I wish to thank the Permanent Representative of Ghana and the Deputy Permanent Representative of Niger for reaffirming their support for the proposed programs, and look forward to our continued collaboration in the countries in these country programs towards the 3 transformative results. Thank you.
I thank Ms. Matal for her response. This concludes our review of the country program documents for Ghana and Niger in accordance with Executive Board Decision 2014/7. May I take it that these country program documents for Ghana and Niger may be approved? I see no objections. It is so decided. If I hear no objections, I also take it that the Executive Board wishes to take note of the first one-year extension of the country program for Guinea, approved by the UNFPA Executive Director. I see no objections. It is so decided. If I hear no objections, I also take it that the Executive Board wishes to approve the second one-year extension of the country programs for Burkina Faso and Chad, as presented in document DP/2022/11. I see no objections. It is so decided. I now invite Ms. Diane Keita to make final conclusion remarks.
Thank you, Madam President. Excellencies, Member of the Board, observers, I would like to take this opportunity to thank you all. First, congratulate the country for their approved country program document and extensions. I would like truly to thank and express gratitude to all our partner and donor countries. These years have been very difficult on every step of the way, and yet we were able to secure the funding for the major program around the world. So our gratitude to you, to the board, to the Secretariat, to the Bureau. I thank you very much on behalf of UNFPA. Thank you.
I thank you, Ms. Keita. This concludes agenda item 5 and also the UNFPA segment.